April is Autism Awareness and Acceptance Month, and over the past few weeks, advocates and researchers have been highlighting the importance of diagnosis and early intervention, which is now finally on the rise among children of color. A CDC review of diagnoses among 8-year-olds across the country found that Black, Hispanic, and Asian children are now more likely to get diagnosed by that age than their white classmates. It is a complete 180 from a decade ago, when white kids were nearly 30% more likely to have an autism diagnosis than Black kids. Experts are pointing to improved screening and increased awareness and advocacy for families of color when it comes to testing for autism spectrum disorder, or ASD. But when it comes to accessing care, a lot of families, they are still struggling. So with me now to discuss all of this is Dr. Helen Tager-Flusberg. She is the director of the BU Center for Autism Research Excellence. Dr. Chris McDougall, he is the director of the Lurie Center for Autism at Mass General Hospital. And Cynthia Lane, she's a member of the Massachusetts Developmental Disabilities Council. She is also a mom of 4 boys, very busy, 2 of whom are diagnosed with ASD. Welcome to you all.
Thank you.
Well, Doctor, can I call you Helen? Is that okay?
Yes, please.
All righty. So, Helen, talk to me about these new CDC numbers. Were they surprising at all?
I think they were very encouraging. As you put it, it is encouraging to see that we're now recognizing autism at earlier ages now in children of color. And that they are beginning to receive the attention that they really didn't have years ago. So in that sense, it was encouraging, but the sharp increase in numbers was somewhat surprising. But I will point out that they're somewhat uneven across different parts of the country. So they're rising more in some areas than in others.
And why is that?
Some states offer more to families of children with autism or disabilities in general. And if they offer more, then I think physicians feel more comfortable diagnosing because they have somewhere to send the children.
That's so interesting. Dr. McDougall, or Chris, can I call you Chris? We're going to go first names, I think.
Please do.
All right, Chris. So, as in your work at Mass General, speak to me about when these CDC numbers come out, and I know they come out, intermittently. How does that change perhaps the work that you do with the doctors under your supervision or even your research?
What it does is it tells us that we're going to need to increase our capacity to properly diagnose and treat more people with ASD. And it's already been a bit of a challenge to try to keep up with the number of referrals we receive. And what it tells me is we're going to need to do a better job in medicine of educating our primary care physicians, pediatricians, family practitioners, internal medicine doctors. We're going to need their help in not only diagnosing, but providing first-line care and treatment for these individuals. The days of having isolated academic autism centers of excellence, I think that's going to need to change. Like any medical disorder, the specialized centers are for more complex cases, but generally medical illness is cared for by primary care doctors and pediatricians. We're going to really need their help.
Cynthia, you have 2 boys that have been diagnosed with ASD. Talk to me about getting them diagnosed in the first place.
Yes, thank you, Crystal. Dr. Chris, I have to say the Lurie Center, that's where I got my son diagnosed, my second child. So it's part of my story as well. So nice to meet you. As far as my boys being diagnosed, my middle child was diagnosed before my oldest. And that was from early intervention he was having at home that I realized there were certain behavior that has to do with autism. Autism was a word that myself, my husband never heard of. And when they said that, we had to look up to see what the word means, the first thing. And to get that diagnosed, it was when we went to the referral from our primary care. When we called for Boston Children, it was a 5-year waiting back then. So it was a long time to get a diagnosis. And to make the story really short for you guys, 5 years waiting when your son is 18 months, you can see what it could done to my son. However, thank God for this early intervention person that was working with my son. We were able to get a diagnosis because she knew someone that worked in the facility. And within a couple months, he had the diagnosis done. And while he had diagnosis, while going to the Lurie Center, there was certain behavior my oldest son at 5 years old was seeing because I was bringing him to these appointments. That's when one of your colleagues said, hey, listen, we need to do more evaluation. And we were able to get my 5-year-old that diagnosis. So I had one later on. And if that intervention was not done, my sons would have been way behind.
Chris, what's it like hearing that from Cynthia?
Well, it emphasizes the importance of early diagnosis because we know that the earlier you can begin intervening with individuals with ASD, the better their long-term outcome. It also says to me that in society, it's not uncommon for me to see people that I think probably had autism, no matter what I'm doing, where I'm at in the city, what I'm doing. And so there's an awareness that's really picked up. And it sounds like it would have been even better if your older son could have been diagnosed earlier. But having one child did result in the diagnosis for your other child.
And Helen, we know that the data points to the fact that kids of color, especially Black kids, are getting diagnosed later than their white counterparts.
Yes, they still are. I think sometimes there's a bias towards seeing other problems, thinking that the autism is reflecting problems that really aren't there, but that there are sort of stigmatized in families of color in our society. Or say for bilingual families, one of the first signs that we see that parents notice at 12 months, they'll tell us, I'm concerned about their language. And it'll get dismissed in families that are bilingual. And it shouldn't be, because we don't think language delay is that associated with bilingualism. It's good to raise children in bilingual environments, but we're still seeing that old view reflected, and that's preventing physicians, clinicians seeing the children as autistic.
Yeah. Cynthia, you mentioned, EI, early intervention services. Did you have any barriers to services in the beginning as you were trying to figure out what your family's autism journey looked like?
Well, I have to say with the early intervention, I was just putting in there. I knew my son because he was less than 3 years old. He couldn't go to school. So that was a place for him to be able to learn something. So they will pick him up. There was not really a big understanding explaining to me what it is and what it's supposed to do. It's the person that came in my house at times that really explained as far as early intervention. That's why now, as I advocate for the parents with children with autism, I say it's very important because now is the first step. I have a 18-month-old, and right now we are going through the early intervention. So he's developing fine. However, the speech language was a little bit concerning. Not saying, at all that he has autism, but I say, hey, those are my concerns. So they came in my house, did the whole evaluation, and then he scored a little bit lower in adaptive. So they'll be working with him like that. That's why it's very important that the first step with parents, and I see a lot of providers are doing now. They are, going out there and letting parents know, hey, have you get in touch with early intervention? those milestones that CDC has in their website, those are the milestones. Your children are getting these milestones the way that they're supposed to. So these things kind of like really help, because early intervention is such a great step for parents who trying to find out if their children have autism, because I know it was the case for us.
And was it hard to get to EI in the beginning?
In the beginning, it wasn't. It was
Oh,
just
wow.
a phone call, and then the evaluation came right away. That's I don't know if because of the location, because at that time I lived in Everett, so it was just a phone call, and then hey, within 2 weeks, your evaluator will come to your house. They will evaluate your son. That's the way it is. And now let's talk about right now for my other son. It took a month to get the evaluator to come to my house. They said they were calling me, which is understandable. But now I'm seeing a little bit of difference where it comes to like other families that we work on that's been saying that they do get a call back right away for them.
Yeah, Chris, are you seeing that there are barriers to treatment? I mean, I imagine just getting someone into your office and getting a diagnosis can be a challenge depending on where they're from and what their community that they're coming from is.
I think that we just heard a couple of very important things. Children can be enrolled in early intervention before they receive a diagnosis of autism. And so while they're waiting to be seen by a professional to make a diagnosis, they can begin to receive treatments that would follow the diagnosis, but much earlier. So that's something. The other thing I'd say is it's what's so impressive is you're taking on the advocacy for other parents and families based on your own experience. And that's uplifting, I'm sure, to Helen and to me, because we need help. We need help, and if it's parent driven, it's going to be very powerful.
Yeah. Helen, in researching for this particular segment, I found a study out of McGill that showed that doctors were hesitant to diagnose ASD in Black families and specific communities. I mean, why do you think that might be?
Yeah, I've been here for a long time. When I first started doing research, and I went to a clinic that was located in Roxbury, I was told there were no autistic children coming to this clinic, that autism didn't exist in the Black community. That's what I was told. I think there's a concern that it would still be stigmatized for those families. And I think that that's no longer the case. And I think the kind of advocacy work that is going on is absolutely crucial for changing that mentality, not really within the Black community,
right,
but more importantly among clinicians, so that these children can get the help that they really need.
What role do you think the pandemic and folks sort of like on the social media, talking to their friends in front of their computers, looking at these things and getting more information from people in that way affected, probably some of the reporting in this study?
Yes, I think so. I think that as awareness is the key to opening the door, and then acceptance, which is the other part of what we're hoping for in April, is to say this is okay. This is not a stigmatized diagnosis anymore. There are things that we can do, and people with autism can thrive in our community as long as we focus on the broad needs of individuals within the community, not just the ones who are very responsive to intervention, but also the ones who remain significantly impaired. We need to accept and open doors for everyone, and that's what April is all about.
That's right. Well, Cynthia, in the last minute that we have here, I want to give you the last few words. What do you want to say to folks in the audience who may be concerned about an autism diagnosis in their families. Perhaps they don't know what it is. What do you coach people through that process and tell others who may not know much about autism and what that looks like?
So one thing that I do is to make sure, yes, I have the experience being a mom of 2 children with autism, but also I make sure I get the proper training. So I do go out there and use programs like LEND program, for example, through the Boston Children, the Family Leadership Series program. So these are programs that family can attend and learn a little bit more about the diagnosis. As far as ourselves, being an advocate with the parents, we put ourselves in the shoe when we first got the diagnosis in order to understand them, because you gotta put yourself with them. I have parents sometimes that reach out through Messenger to me. They say, we don't want you to say anything. We don't want to come out right now, and daily posting, those are the things encouraging that I do, especially on the website of Black Autism Coalition, so they can see and kind of like learn. But like that interaction, putting yourself back to that diagnosis with them, that's where it all starts. And then teaching them, because one thing, I didn't have these resources. I didn't have nobody to tell me what to do. So I took the initiative as a parent. Because I didn't have it, why not teach people what I have? So anything that I know, I have a WhatsApp group. I go sneak it in there. I say, hey guys, did you know about this? Did you know about this event? Let's go to this event, in order to empower them, because that's what we want. We want that empowerment. And I want to say out there too, anybody that hasn't diagnosed their child, that has been seeing certain things, one thing, make sure you keep a diary of everything your child is not doing. So that way, when you go to your provider, you can say, this is what I see them doing. This is what I see them not doing. This is what I find kind of bizarre, or this is what bothers me, because at times us as mothers, we don't remember everything. And when we go to the provider, we go in a rush, while they're in a rush as well. So that diary is what's going to help us out. And I know there's a lot of providers that are doing their best. Just like Dr. Chris said, they are doing their best to learn from us. I've had people that say, hey, Cynthia, come out. How can we refer some families to you as they get the diagnosis? We want that. We want to come as a community to do the work better.
All right. Well, thank you so much for your time, Cynthia Lane, Dr. Helen Tager-Flusberg, and Dr. Chris McDougall.
Thank you very much.
Thank you, Crystal.
Yeah.
Thank you.